Late nights, skipping the cleanse routine, going to bed with your makeup on. We can put our skin through a lot over the years. Thankfully, Cotia has combined Deer Milk with powerful actives to create skincare that genuinely keeps up with your lifestyle. And thousands of Aussie women are already obsessed. Keen to see what all the fuss is about? Use code MAMAMIA20 for 20% off your order. Cotia, because your skin deserves something extraordinary.
Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney and today we're going to be doing a quick kick and we're going to be focusing on a retained placenta. So I thought I would start by sort of talking about what happened with me when I had my babies. When they were finally born, when they're finally out, I realised by the 4th child that I had developed a bit of a pattern, which was, first of all, I would hold my breath, waiting for the baby's first cry. Then there was this enormous relief when I heard that cry, followed by a rush of emotion. Finally, I would say, is it a girl or is it a boy? And long-time listeners would know that every time it was a boy. And then for me, the next hours went on as expected. And actually, that would be a good episode topic for another podcast. But this podcast is about retained placenta. And so for my 3rd stage or management of the placenta, it was just incident-free. It just happened. But for some women, this story doesn't end there. When the placenta doesn't come out as expected, everything can change in an instant. Today, our quick kick is from one of our longer episodes about retained placenta and retained products. But we wanted to give everyone a bit of a refresh on what it is like if you have a retained placenta. Pat and I chatted about this and we thought, actually, let's start with a story. And this story is fictional, but it's based on his experience of helping more than 4,000 babies to be born, and also on what we get told by you, our dear listeners, on our DMs. Often this story is prefaced with everything was fine until it wasn't. So her name is Emma, and for her first birth, she was active in labour for a long time, about 10 hours. She was exhausted, but was close to the finish line and ready to push. Buoyed by a rush of exhilaration, she pushed out her baby girl, a screaming bundle of bliss. She named her straight away her Charlotte. For a moment, everything was calm. Charlotte snuggled in, chest to chest, and together, Mum and Bub tried breastfeeding for the first time. Emma had an injection to help her uterus contract, but after 30 minutes, her obstetrician tried some gentle traction of the placenta cord, and the midwife started rubbing her tummy, which she found really unpleasant. The placenta was still not delivered, and then suddenly, Emma began to bleed really heavily. She remembers the rush of staff, the urgency in their voices, and being wheeled into theatre to have a manual removal of her placenta. Emma didn't have an epidural in place, and the fastest thing to address the bleeding was to have a general anaesthetic. She woke up to Charlotte in her partner's arms, dad and daughter together as a family. She was thrilled and felt she could finally breathe, that they were all safe. But she still has not quite processed the fact that after all her hard work throughout the labour, that she felt robbed of that first chapter of her baby's life. She didn't know anyone else that this had happened to. She hadn't even realised that a retained placenta could be so traumatic. We tell this story because we don't want anyone to think, why did no one tell me? We hear constantly that our program, Grow My Baby, is the reason that people have a knowledge bank to draw on during their pregnancy and birth that helps them feel calm, even if their pregnancy and birth takes a path they didn't expect. This made us think that we want more people to have the program. So for the next 2 weeks, we're going to, for the very first time, put our programs on a Black Friday sale. So if you're listening to this between November 18, 2025 and December 1st, our signature pregnancy and birth program will be discounted by 20%. that is week by week, in-depth information about your pregnancy, pain relief techniques in labour and birth, common interventions, how to ask informed questions of your providers, information on all the tests and scans that you might be recommended, some physio-led pelvic floor exercise in pregnancy, how to have a great postpartum recovery, medication safety, and there's just so much more. There really is all the information that you need in over 50 bundles, which you can either access by drip fed week by week, or you can binge at your own pace. It's all aimed at building your confidence right through your pregnancy and the first 6 weeks of cuddling your baby. So you will never have to say, "Why did no one tell me this?" So if you're listening to this and you are trying for a baby, this discount also includes our mini course on getting pregnant. We invite you all to join us as you grow your baby. Go to growmybaby.com.au and use the code BABY20, baby is all capitals, to get your 20% off. The link will also be in our show notes, or just drop us a DM and we can send you the link to that as well.
If you're in the market for a classic pair of boots, you'll love this. For 5 days only, from November 27th to December 1st, you can get 15% off full-price lifestyle Blundstone boots during the Black Friday to Cyber Monday sale at selected Blundstone retailers. These boots are so versatile. They go with pretty much everything, whether you're dressed up, dressed down, or somewhere in between. They just work. Grab yourself a pair of Blunnies. Find a retailer at www.blundstone.com.au/stores.
Now, let's catch up with Dr. Pat to learn more about retained placenta at birth. So, can you define for us what a retained placenta is?
Well, that's a placenta that's still in place after an hour.
Like the whole lot?
All of the placenta.
Right.
Is that what you mean?
Yes.
Yes. Well, you might. Well, it's a good question. See, sometimes you pull you pull gently on the cord to encourage it, and maybe the cord snaps.
Yeah.
Okay. So the bit of the cord up near the placenta might come out, but not the placenta itself. And occasionally you get just a little bit coming out, but not most of it.
And does it ever happen that you've seen that the placenta comes out in bits?
Yeah, it can come out in bits, and so we need to be confident that it's all out, or practically all of it is out.
And if it is, sorry to describe it like this, but if it does look like a beef brisket, how can you tell that it's all out?
Well, there's a couple of different techniques. Firstly, if someone's bleeding and you get the whole placenta out, they'll probably stop bleeding.
Oh, yeah.
The placenta can be put out on a table and arranged. So if it's in bits, you can put the bits back in like a jigsaw puzzle and say, okay, it looks pretty complete.
Yeah.
And if there's a big bunch of jigsaw puzzle pieces missing, then they're probably still inside the patient.
Yeah, right. Do you have to do that very often?
We always examine the placenta to make sure it's complete.
Yeah.
Every single time, but it's not incomplete very often.
Okay. How common is it to have a retained placenta?
Well, it depends on your time limit. Somewhere between 1% to 3% it seems to cover most of the international data.
And in your opinion, like 3% doesn't sound like a lot. What do you think? Is that?
Well, 3% is plenty of people,
right?
So this is a significant complication of birth. It is what's behind quite a large number of the severe postpartum hemorrhages that happen.
Yeah, right. Yeah.
Okay, the uterus finds it really hard to clamp down if the placenta's still in there, and it's the uterus clamping down that stops everybody from having a postpartum hemorrhage.
Yeah. So tell me, is there actual reasons why it happens, or is it just random?
Yep, sometimes it's just what doesn't want to come out. It's just a little bit stuck. Or the cervix is trying to close up again.
Ah.
Yeah. Or an inexperienced person maybe has pulled too hard on the cord and broken the cord, and therefore there's nothing left to pull on anymore.
Yeah,
so
wow.
the placenta sits in there. And sometimes, and this is more serious, sometimes it's abnormally stuck to the inside of the uterus.
I know, that's got a name, hasn't it?
That's called placenta accretor, and that's a bigger problem because you know, if you pull on that placenta, it won't come out.
Yeah, right. Why does the cervix close too early?
Well, everyone's cervix can close eventually. It can close up eventually. And I think, if you examine someone in an effort to get a placenta out, to get it unstuck, the cervix is always closed a bit after the baby comes out, but not normally enough to hold the placenta placenta back. Yeah. And so if the placenta has properly disengaged from the internal aspect of the uterus, and especially if there's a little bit of gentle traction on the cord, then it'll push that partially closed cervix back open again and let the placenta out.
And why do some uteruses not sort of contract down again?
Yeah, so the placenta might still be in the uterus because the uterus just isn't clamping down enough to shear the placenta loose from the internal aspect of the uterus, and we might see that's the so-called atonic uterus, where it just won't clamp down properly. And we certainly might see that in a really, really long labour where the uterus is too tired. Or where we've used tons of syntocinon and really pushed that uterus, a lot so that it's too tired.
Yeah.
Or if the uterus has form for not contracting down, like this happened last time and the time before that.
Yeah, right.
In that woman. Or if the uterus has got a problem that affects its ability to clamp down, like it's full of uterine fibroids.
Right.
And the muscle just isn't as good.
And what about like differently shaped uteruses? Do they...
Yeah, so
contract down?
sometimes the heart-shaped uteruses don't contract as well as the normal shape. And it's hard to contract as well if the uterus has been over-distended in the first place by twins, triplets.
Really big baby?
Yeah, really big baby. Or polyhydramnios, they're way too much water.
Oh, yeah.
And so, for example, if any of those things, if this is the vaginal birth of twins or of a really big baby, or a reason why we would expect the uterus to contract poorly, then ideally we would have identified that as a potential problem during the labour and been ready to go to manage it quickly if it actually happens.
And that's that third stage management.
Yeah, so normally we might give just the injection in the leg that helps the uterus contract and the placenta disengaged. But for someone who was a sitting duck for this problem, like they'd had it happen before, then we might also put up a bag of syntocinon to help the uterus contract, or put some tablets in your bottom to help the uterus contract. We might do extra stuff, knowing that if we don't, we're more likely to run into trouble.
I know this is about obstetric management, but what if you've given too much syntocinon? And that's the reason why the uterus wasn't contracting down. What's in your toolkit then? Not more syntocinon?
No, more stuff to help the uterus contract in other ways.
Yeah, right.
Yeah. And so getting that, like rubbing it. So if someone's jumping on your tummy and rubbing your tummy to try and get that uterus to contract, it's all about tone. So we want the uterus to contract firmly, the placenta to be expelled, and then once the placenta's out, the bleeding will stop.
And what about cesarean birth? Like you've got a pretty good view there.
Yeah, well, you don't tend to get the one at cesarean section. You won't get the ones that are stuck for no apparent reason, because if they're stuck, you just put your hand in and take it out.
Yeah.
Okay. And you can easily get your hand in the plane between the uterus and the uterine wall and the placenta, and just help it disengage. But we certainly. Some of those ones where it's abnormally stuck, they may be diagnosed at cesarean section.
Oh, yeah.
Okay. Sometimes the risk of the placenta getting abnormally stuck depends on a number of factors, but one of the important factors is if the woman's had multiple previous cesarean sections.
Yeah.
So if she's had multiple previous cesarean sections, then this birth's going to be both cesarean section. And sometimes we don't know that the placenta is abnormally stuck until we try and get out at section.
So thanks everyone for joining us in this episode. If you found this story helpful, fantastic. If you know of somebody that also would find it helpful, please share it with them. And if that person or yourself would benefit from expert information throughout their pregnancy, we invite you to jump on the Black Friday sale to receive 20% discount on all our programs. Please use the code BABY20, babies all in capitals, at checkout at our website growmybaby.com.au. All right, for now, keep well, keep growing those babies, and we'll be in your ears next week. Bye for now. Hey, even though Dr. Pat is, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
Struggling with the anxiety that comes with adulting?
Or maybe you've suddenly become the parent to your parents.
Wondering if you might have ADHD, but unsure if or how to get a diagnosis?
I'm clinical psychologist Dr. Anastasia Horonis.
And I'm Ashani Dante. We're your hosts of But Are You Happy?
Bringing you all the self-development and mental health information you actually need.
New episodes drop every Saturday morning.
Just in time for your hot girl walk.
So tune in to But Are You Happy? The podcast where overthinking finally gets the spotlight it deserves. Made in partnership with Medibank.